But good principles are easy. Holding them consistently is the hard thing. Hello YouTube, Jeff Bosco here. I'm gonna react to this video a friend of mine, Matt, sent me. And I don't like long introductions, so I'm just gonna get right into it.
As you may have already heard, it's all starting to unravel. It had to happen. At 3:05 p.m. today...
No, it's all happening. It's happening, yeah. I tend to be very cautious about those kind of statements nowadays. After I went through the 2012 Ron Paul revolution, everybody sees one thing in the news and starts getting excited that some popular uprising is going to happen. And my whole point of this video is not to be on one side or the other of this debate, but just to let the people who are on the side of the anti-lockdown just don't get too excited, okay?
An economist in the Victorian Department of Finance and Treasury, Sanjeev Sabhlok, announced that he had resigned last week, I quote, "at length, so that I would be free to speak out against the state's management of the COVID-19 infection. I made a number of criticisms of the state government on social media. The head of human relations at Treasury asked me to remove them."
The head of human relations, I'm assuming that's kind of like their version of PR. That doesn't seem like an out-of-hand thing to do, considering that he works for the government and it's the PR department's job to manage how the public sees them. And even if you don't agree with it, I mean, you got to ask the question, on whose behalf is he really making that demand like that?
Resigned on the same day, the only honourable course for a free citizen of Australia. He said, "I never dreamt I'd see some of the tactics being used to defend the state's health."
Well, I looked up this guy, Sanjeev Sabhlok. I'm not going to cast any aspersions on his character because it takes guts to do something like this and stand up for what you believe in. But he said, "I never dreamed I would see some of the tactics being used to defend the state's health." And that's just a lack of imagination, because it's either a lack of imagination or you've been completely ignoring people who have been warning about government's abilities to do all these things for a long time.
The pandemic policies being pursued in Australia, he wrote, particularly in Victoria, are the most heavy-handed possible, a sledgehammer to kill a swarm of flies.
Standard operating procedure for government.
He went on, "These policies are having hugely adverse economic, social and health effects, with the poorer sections of the community who don't have the ability to work from home suffering the most. Australia," he said, "is signalling to the world that it's closed for business and doesn't care for human freedoms. This will dampen business investment, but also impact future skilled migration, the education industry and tourism." Unquote. Now, echoing what I've been saying for months, this former Victorian Treasury economist said, and I quote, "The whole thing hinges on the scare created by politicians and health professionals."
The whole thing hinges on the scare created by politicians and the health professionals. See, this comes down to a big question of, where does the scare come from? Are people just responding to government scaring them, or are people scared and the government is responding to their fear? And that is a huge question here that nobody is asking. And for my part, it's much less the way here than the opposite.
Professionals. For instance, Victoria's Chief Health Officer, Brett Sutton, claims this is, quote, "the greatest public health challenge since the Spanish flu," unquote. He writes, "This is no Spanish flu. We can verify that easily. The Spanish flu killed at least 50 million people worldwide in 1918, when the global population was 1.8 billion. Proportionately, to be as lethal as the Spanish flu, a virus would have to kill today at least 210 million people. Instead, only around 0.9 million have died so far. Compare this, he says, with the 60 million who ordinarily die each year.
I don't think any of these facts matter, so I don't even get into these arguments with anybody about any of this stuff, because it's not... I mean, you already stated that it's the scare that's the most important thing. And when you're dealing with that kind of fear, these kind of facts don't really matter, because people are just going to choose the facts that they want based on their own fears and assumptions.
Sanjeev Sabhlok said, quote, "But even if the pandemic had been as big as the Spanish flu, lockdowns could never have been justified. There are strong scientific arguments against lockdowns. So what should the government have done?" He said the data were clear from February itself, that the elderly are many times more vulnerable to a serious outcome than the young. It was necessary, therefore, to work out a targeted, age-based strategy and start aggressively protecting and isolating the elderly, even as the rest of the population was advised on relevant precautions. But he said that wasn't done. He wrote, "The need for good policy process does not disappear just because we face a public health crisis. In fact, it gets even more urgent." He wrote, "The Victorian Guide to Regulation notes," and he quotes, "it is not possible for governments to provide a completely risk-free society or to prevent every possible event that might cause harm."
That's a very good principle, but good principles are easy. Holding them consistently is the hard thing. Well, what is the optimal level of risk mitigation that is justifiable by governments? Our own current state of affairs is that, try and name one risk. Editing Jeff here, interjecting because I didn't say what I wanted to say here very well. I can't speak to Australia, but here in the US, we have all kinds of layers of government-mandated insurance that cover nearly every ordinary possible event that might cause harm. I know that sounds like hyperbole, but just try and think of some risks you don't have an insurance policy against. I bet it's taken you a while to come up with anything. It's been like this for quite some time, and I didn't hear many complaints about it before the pandemic lockdowns. But now that governments are using these same socioeconomic structures exactly how they always have in the past, and we're supposed to be shocked.
It says risk regulation that is poorly targeted or costly will divert resources from other priorities, unquote.
Again, okay, so nobody was talking about risk management before the pandemic. And all of a sudden the pandemic comes, and out of nowhere the government has all this power.
Governments back in February, he said, needed to commission a cost-benefit analysis of alternative policy options that took into account different scenarios, such as with and without a vaccine. Sanjeev Sabhlok said, thereafter, the best option had to be picked, given the uncertainty, but consisted also with the need to intrude minimally into human freedoms.
Who says anybody wants that?
This cost-benefit analysis and policies needed then to be updated as new information emerged. He said, such as the fact that epidemiological models have badly exaggerated the risk. He wrote, I attempted repeatedly to raise my voice, but my attempts were rebuffed. The bureaucracy has clamped down on frank and fearless and impartial advice.
The clamping down on frank and fearless impartial advice is what's supposed to explain how everybody went along with the lockdown, because everybody just manipulated from top down by unscrupulous leaders. And I think there's some of that, absolutely, but I don't think that's the entire story.
In a misplaced determination to support whatever the government decides, instead of performing its taxpayer-funded duty of providing forthright analysis of alternatives. Well, listen to this. He goes on. While there is scientific argument against lockdowns, there are divergent views on matters such as the effectiveness of masks. He wrote, I am a mask fanatic, but there was never any reason to mandate these debatable requirements. Voluntary, performance-based rules would allow the private sector to innovate, leaving people to determine their own fate. Now, if I just interpolate here, this is what I've been saying. We can look after our own health.
Who does that, though? Oh, it's not about what you think the people want. You look at what people are doing. That's not what people are asking for.
But the doctor goes on, quote, thereby minimising economic harm and harm to mental health and general well-being. Now, cop this. He says, quote, so what happens now? Billions of dollars of income and wealth have been wiped out in the name of a virus that is no worse than the Asian flu, and which can even now be managed by isolating the elderly and taking a range of voluntary, innovative measures. He says all the border closures, all the lockdowns, all the curfews in Melbourne will not eradicate the virus from planet Earth, unquote. Now, as I've said many times, politicians can't eliminate a virus. Well, The Economist concludes, and I quote, the problem for politicians now is to reverse course without losing their job. I don't know how they plan to do it.
See, this is assuming that there's going to be some massive populist uprising, and I'm just very skeptical of that.
He says, but if they don't do it sooner rather than later, the damage to Australia's future would have become so great, it will undo the good work of decades of reform.
That's assuming people put those two things together, and then that's not clear that people are going to do that.
Unquote. That's Dr. Sanjeev Sabhlok, the Senior Manager of Economic Strategy advising the Victorian Government. He's resigned on a range of efficiency, productivity, market and regulatory reforms, on cost of living issues and aspects of tax reform. He's got a PhD in economics from the University of Southern California. My point is simple. And without pumping up my tyres, Adam Crichton and I have been saying this for months. So's Andrew Bolt. One question remains, doesn't it? How many others have been silenced across all arms of government, including in Canberra? Will this doctor now be condemned, and does this failed strategy stay in place? I've warned over and over again that the political leaders who are the architects of this response will not be able to escape the kind of criticism that is now finding its way into the public place.
That's a very bold statement based on one bureaucrat resigning his position in a economics branch of the government. But yeah, I don't see that happening yet.
In fact, it's worse than this. I have said we need a national advertising campaign to tell the public the truth about the fact that this virus is not a pandemic.
We need a national advertising campaign. People need to be afraid of what I'm mad about, but not what the government is mad about. And it's just this game where it becomes like, who's controlling who? And that's a question here. Is it just simply everybody at the top of the pyramid controls the fears and motivations of the ordinary people? But that kind of top-down thinking doesn't work for me because, you know, people get to the top of the status hierarchy by doing what people want them to do, and then they get paid to do it. And it's not an easy question to answer of who's really in charge. And the mistake he's making here is simply saying if the right message just got out to the people, they would be afraid of what I'm mad about instead. And then they'd see it all my way. And that ignores the fact that all these structures that are being used to implement the lockdown were built over the course of over 100 years. They didn't just show up at the beginning of the pandemic. And it's not going to be like snapping your fingers and throwing those things off. Nobody's even talking about that. You know, I asked the question, why did people go along with the lockdowns at the beginning? Is just the government that good at hypnotizing people? I don't think so. if everybody had questioned the lockdown at the beginning, they would have had to run into these structures that are now being used to enforce it, whether that means police, consequences in insurance premiums, blah, blah, blah. And like I said, those structures were built over the course of a long time, and we're not just going to snap our fingers and go back.
Now, some eminent opinions are being expressed through 3 sets of data compiled by officials in Massachusetts, New York and Nevada that, listen to this, up to 90% of people testing positive carry barely any virus. Oddly enough, this was reported in the New York Times. Now all this emphasis on how many cases, how many people have tested positive, I've said from day one, is rubbish. But that will all keep for another night.
Yeah, I think I said everything I wanted to say.